Welcome back to Generation Girl Code. July 16th marks Birth Trauma Awareness Week. What is birth trauma exactly? Birth trauma is any physical or emotional distress a person may experience during or after childbirth. Like postpartum traumatic stress disorder, or PTSD, birth trauma does not have a specific timeline and everyone's experience differs. Some examples of postpartum PTSD include difficult labor that was long and painful, an unplanned C-section, or emergency treatments. The National Institutes of Health reported in 2022 that 45% of birthing individuals experience postpartum birth trauma with effects that last long after pregnancy. We want to acknowledge the hardships that don't always have light shed on them, and while birth trauma can impact anyone, as with many things in our society, birth trauma impacts people of color most starkly. The Centers for Disease Control found that Black women are 3 times more likely to die from a pregnancy-related cause than white women. The CDC report reads, multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health. Due to these conditions, more women of color have began seeing practitioners who they can identify with to ease the stress of pregnancy factors out of their control. Women of color need to feel like they can trust those who they are seeking help from, especially when it's concerning their life and their child. As traumatic situations vary, so will the solutions for birth trauma. One potential solution could be trauma-focused therapy designed for those dealing with PTSD and understanding everyone's journey is a personal experience that requires patience and grace with oneself.